Hi everybody, it's Professor Miller. This lecture is going to cover stress and disease. Some of the concepts that we talk about with different hormones and the hypothalamic pituitary axis, we will cover obviously when we get into endocrine and in reproductive as well. But it's important to kind of take a look at this as we move into different systems like the cardiovascular system, endocrine, all of that. Just to have a good foundation of the understanding of how stress can lead to disease, essentially. I did post two different articles on our course Moodle site. One is related to geriatrics and the other one is pediatrics. And it's essentially related to stress and childhood adversity. It's just quick articles that you can kind of browse and take a look at. Unfortunately, we live in a world that's filled with stressors, and unfortunately, some individuals or populations can have greater exposure to stress. It's well known, like childhood adversity or stress that's induced by socioeconomic factors, that they can unfortunately precipitate, exacerbate, or even contribute to the onset of disease. So we'll kind of talk about this too as we move through different disease states too. In general, obviously stress, this is just like a general definition where they experience stress and the demand essentially exceeds the person's ability to cope. So there can be multiple reactions such as disturbances in cognition, emotion, behavior, and obviously it affects the well-being negatively. Stress definitely has a significant effect on different organ systems, whether it's your cardiovascular system, your immune system, your hormones, etc. But once again, it can lead to many different diseases or conditions, whether it's a physiologic condition or a psychologic condition as well. So it's really an integrated process of a physiologic and psychologic response, essentially, to stress. So once we get to that point where our normal adaptive mechanisms cannot meet the demands, that's when these changes, like the physiologic changes or psychologic disease, can occur. At the beginning of your textbook in this chapter, there is some introduction to research surrounding stress and disease. And Saley was one that was a pioneer, essentially, kind of with research on stress and stressors, essentially. And some basic foundational knowledge was gained through some of this research, and found that there's an enlargement of the adrenal cortex, which obviously is related to cortisol release. Thymic atrophy, which is related to your immune system. Development of bleeding ulcers in the stomach or duodenal lining. These were some of the three key areas that were discovered through his areas of research. And I'm sure all of you know, if you work in an area, especially critical care, ICUs, all these patients they're at high risk for ulcer development. So a lot of times they're on medications to prevent ulcers. So even if it's a physiologic stress on the body, there's negative outcomes as well, whether it's your immune system or, factors like ulcers, essentially. Three stages. I don't expect you to memorize this by any means. It's just kind of to give you a background with it. But obviously there's that arousal stage or alarm stage. And really when you think about the stress response, it's really about that sympathetic response where you have that fight or flight response. So when you think back to just basic patho or basic physiology, we have that response where you have epinephrine and norepinephrine and the effects of it. If you work in those areas of critical care or the ER, you think about epinephrine and those effects on the heart, the lungs, all of that, or, your alpha and beta receptors. So once again, you start this, arousal or stimulation of your sympathetic nervous system. Stage of resistance or adaptation. This, again, contributes to that fight or flight response. Once again, this is where all those mechanisms kind of kick in. In stage of exhaustion, this is essentially how onset of disease occurs, or progressive breakdown of those mechanisms are altered, essentially, at this point. And this is how the negative outcomes essentially occur. Psychologic mediators, once again, this was kind of in the original research that was presented in your text. A reactive response essentially is a physiologic response to psychologic stressors. So it just basically makes sense. There's a reactive response there. You're exposed to stress at some point in time, and you have a normal physiologic response to it. However, there's some more maladaptive areas that can kind of occur here where you have an anticipatory response. And this is common with all of us. I mean, if you think about anything, like whether it is you have a fear of flying or you have a fear of taking tests or whatever it may be. And it's common in patients too, like if you think about like an anxiety disorder. And a little more severe form of this would be like a conditional response. So they're always typically associating that stimuli with danger. And this is highly associated with like PTSD. So any type of memory that's triggered by some kind of stimuli in their environment, it brings back these memories of a traumatic event. They can have flashbacks, sleep disturbances, depression, etc. So if you think about stress, obviously it feeds into a lot of these underlying mental health issues as well. And once again, too, anxiety disorders. You'll see this commonly with that. Patients will have a fear of, if they have anxiety shopping or whatever it may be, they almost anticipate it. Or every time that they go to a certain area, it may trigger this response in them. So it's basically, a form of a psychologic mediator, essentially. In terms of stressors, obviously this is very general, but once again, it's anything that demands a response in order to maintain homeostasis. So things like noxious stimuli, whether it's pain, cold, trauma, hunger, shock. And these are even factors too, like a severe infection or surgery, things like that, any type of alteration to the body. Or non-noxious events, and these are things more psychological, whether it's a life-altering event, a death of a spouse, family member, any major life event, and even good things like weddings or a birth of a child. Any type of life-changing event can be a stressor, whether it's good or bad. There's a response to that. So obviously what we worry about is long-term maladaptive responses to stress and the onset of disease. It's, heavily linked with cardiac disease, whether it's hypertension, even like diabetes and things like that. There's a lot of links there with chronic disease, essentially. It can also worsen existing disease. This is very, very common. You'll find that patients that suffer from irritable bowel syndrome, they often have flare-ups essentially when they have increased stress in their life. Same thing with asthma, autoimmune diseases, very, very common. You have patients that have rheumatoid arthritis or lupus, and it's not uncommon that when they're under a lot of stress that they actually will have a flare-up of it. And a lot of it too, there's actually links with stress and the onset of autoimmune diseases as well. HIV progression as well, because it does affect your immune system. Basically, the stress response is integrated with your nervous system and your endocrine system as well. So it's kind of a coordinated response that affects all of your systems, essentially. And we'll talk about that too. As I said, like when we move into the nervous system and endocrine, we'll kind of cover this in more detail. Psychoneuroimmunologic mediators, this is another area that they've researched as well. And a lot of it is related to basically that interaction or the combination of basically the brain, your nervous system, and your immune system. So it's the link between your consciousness, your nervous system, and mechanisms of self-defense. And it's multifactorial, so there's a lot of different areas that feed into this response, essentially. The big thing to kind of understand is, the endocrine response. And once again, we'll cover this when we get into endocrine too, but this stress response originates obviously in the brain, and it's stimulating your hypothalamus to release CRH, which is corticotropin releasing hormone. This is what stimulates your anterior pituitary. It's basically a feedback cycle. And then your posterior pituitary basically stimulates antidiuretic hormone. It also stimulates your adrenal glands to release cortisol. So it kind of sends this whole feedback system or this trigger system essentially that will end up releasing increased antidiuretic hormone and vasopressin, which when you think about it, that has an effect on your cardiovascular system. And then when you have an increase of cortisol levels, that has a whole slew of reactions as well, which we'll talk about in a minute. But corticotropin releasing hormones has a central effect and a peripheral effect, which I'll talk about too. Immune modulation by stressors leads to, or can lead directly to poor health outcomes essentially in patients. In terms of the central stress response, once again, we talk about that fight or flight response. So catecholamines, these are things like your epinephrine, norepinephrine. And remember, when you think about where these catecholamines or what organ systems they target, you got to think about like the heart, the lungs. And we'll talk about this during cardiovascular as well. I just want you to have a basic understanding here of how it affects it. But they're released from the adrenal medulla, once again, because it's stimulated through that hypothalamic axis, essentially. So you secrete large amounts of epinephrine and small amounts of norepinephrine when it's stimulated. And there's a lot of different functions or actions of those receptor activation through alpha and beta. But remember, like things like your beta 1 and beta 2. Beta 1 is basically that increased heart rate and force of contraction. So when you think back to just that fight or flight response, you're going to have an increased heart rate, increased force of your contraction of your heart. Beta 2 has a significant effect on gluconeogenesis. So that's why a lot of times blood sugars will be elevated. And I'm sure, once again, with working in the hospital, you'll find that those patients that are critically ill, or any patient essentially that's hospitalized, typically there's an underlying process there that puts their body at stress, and they tend to have elevated blood sugars. That's why a lot of times you'll see sliding scales in the hospital to maintain normal blood sugars, essentially. But once again, it's because of the stress response. That is exactly why they end up with elevated blood sugars. And a lot of times too, like your alpha and beta, they redistribute your blood flow. So shifting that flow from, the peripheral sites to your major organs like your brain and your heart. And once again, you can just take a look at that table. It's on table 11.1 and 11.2. Just basically, it's like your sympathetic nervous system. But we'll talk about these later too. Cortisol, once again, is released. So cortisol is actually, and I'll talk about this in a minute, it's basically hydrocortisone. But it's activated by ACTH, so that's where your adrenal glands essentially are secreting cortisol. Cortisol has many significant effects. So even if you think about a patient that's taking prednisone is basically an exogenous form of cortisol. But these patients will often have elevated blood sugars. So that's an effect of elevated cortisol levels. So anytime you have stress, your cortisol levels rise, and a lot of times you'll have uncontrolled blood sugars. It can have an anabolic effect on the liver or catabolic effect on other tissues. It's lipolytic in some areas of the body and lipogenic in others. So a lot of times too, even when you think about patients that are on high-dose steroids, and you'll get to this in pharm, but they get almost like a Cushing type reaction from it if they're on high-dose steroids for a long time, where they have adipose tissue basically more deposited in that face area or the trunk. They'll have truncal obesity. And you hear about this, the cortisol reaction in patients having weight gain, and that's not uncommon with stress, and they tend to gain it around the midsection. Cortisol in general does have a significant anti-inflammatory response, and it also has an immunosuppressant response. And once again, we actually use this as a treatment a lot, and as you get into further courses, you'll find that we use steroids like prednisone very frequently for a lot of inflammatory processes, whether it's an autoimmune disorder like rheumatoid or lupus. A lot of these patients are on prednisone. So it does have a significant anti-inflammatory effect, but the side effect to it as well is immunosuppression. So once again, cortisol, just like, cortisol is an endogenous form of it, just like an exogenous form that we give a patient, it can suppress the immune system. There's a table on 331 that you can basically review. I don't expect you to memorize every single little thing. The big things to understand is that, it's not uncommon to have elevated blood sugars. They can have, changes with weight gain, things like that. So some general basic information there. In stress and immunity, this is a big one. There's a significant impact on your immune system, which is why patients who are under a lot of stress, they tend to get sick more often. Whether it's, physiologic stress or psychologic stress, it's very common for patients to be sick or to get sick easier, essentially. And a lot of times it's related to cortisol. And we'll get into the immune system, but like your T helper cells, there's 1 and 2. One's more responsible for your innate immunity, which is that initial response. And the other is more responsive to your adaptive or humoral immunity, and that's where we develop antibodies. And they actually describe it as like a shift. So what happens is that there's actually a decrease in that cellular innate immunity, which is the initial response to like an infection. So there's actually a decreased response there. However, there's actually an increase in your adaptive immunity. So this is where you develop antibodies to, to infectious microorganisms. However, it puts them at risk for developing like autoimmune diseases, because remember, autoimmune diseases are basically destruction of self, or identifying yourself as foreign, essentially. So you attack your own system. So a decrease in cellular immunity, they end up with immunosuppression. So that's why they're at risk for infection. And that's more of your innate response. And then your humoral immunity, or your adaptive immune system, they have that heightened antibody response. So that's why they're more at risk for autoimmune diseases. And you actually will see sometimes the onset of an autoimmune disease with severe stress as well. That's not uncommon. And the other thing too is when, for instance, you have a patient that has rheumatoid arthritis or lupus. Like I said before, a lot of times these patients will have flares, when they're under a lot of stress. It's not uncommon. It can have alterations on other hormone systems, and once again, we'll talk about this with endocrine and the reproductive system. So just generally, I just want to kind of go through these really quick, but it can basically have effects on luteinizing hormone, estradiol, your progesterone levels, and that's another reason. So if you see patients that are under an extreme amount of stress, there's something, going on for a period of time, it's not uncommon. Sometimes you'll have female patients tell you that they actually missed a period, or they have irregular cycles at that point in time. And it's because it can disturb your other hormones. When we get to endocrine, it's kind of a cascading event, or they kind of curtail into other hormones, or one hormone can kind of affect another one. So sometimes you'll see alterations there. But basically, your estrogen can stimulate that HPA axis, which can actually cause cortisol release as well. And that's actually another reason why sometimes certain disease states are more prominent in women, because of the estrogen there. So estrogen can have an effect with cortisol, is all that I'm basically saying with that. But like higher levels of cortisol, once again, increase the risk for like inflammatory disorders, depression, mood disorders, eating disorders, and estrogen's heavily linked with that as well. So it kind of interplays together. Other pathological effects of CRH on women, these are more central, but obviously, once again, you don't need to memorize all these. I'm just trying to give you examples. But an increased level, they have high levels of cortisol, but it can impact depression. It can have impact on eating disorders, the onset of alcoholism, osteoporosis, visceral obesity, infertility. And if you have a decrease, they can also have a risk for depression as well. But it's been linked to with things like chronic fatigue, fibromyalgia, rheumatoid arthritis, postpartum depression, premenstrual tension, and menopausal depression. So they are linked, whether it's increased or decreased, to a lot of underlying disease states, essentially, in women. At the peripheral level, because once again, cortisol can, CRH can have an effect at that peripheral level as well. And if there's increased levels, once again, it can have things like inflammatory disorders, or it can affect labor or premature labor. It can cause early menopause. Any decrease can cause delayed labor, ovarian dysfunction, anovulation, which is lack of ovulation, defective corpus luteum function, so that's like the lining of the uterus, issues with infertility or spontaneous abortion as well. There are some beneficial effects actually from stress hormone alterations as well. When you think about endorphins or enkephalins, basically those are like your natural endorphins, essentially, that actually have a protective effect for pain relieving. And sometimes you'll hear, like an endorphin relief with humor or laughter or exercise. That's the other thing too. And that's a good reason why we actually recommend, treatment strategies that center around, exercise or stress relieving, or even humor. We'll talk about that later too, but when we get into mental health as well. But there's a protective mechanism here with our endorphins and enkephalins, essentially. And enkephalins you'll see a lot with even like it's related to like that runner's high. So patients that exercise, they actually get an increase in endorphins and enkephalins. But basically, it can also help with pain. So actually, another thing too is like at that, even in your fight or flight response, if you had a severe injury, it actually helps protect the patient from that sensation of pain. So it does give a positive feeling of well-being, a sense of euphoria, and it also does help with pain management as well. And this is like your natural response essentially to that. Other hormones that can be altered is your growth hormone, and that's once again produced by your anterior pituitary. It also is in your lymphocytes, mononuclear phagocytes. Once again, don't memorize this because we'll get into this when we kind of go into there. The only thing I really want you to understand is that it can have an effect on your growth hormone. And growth hormone can have a big effect on lipids and the effects of insulin and blood sugars. It also has an effect on tissue repair. But when you're under stress, there's a decrease of growth hormone from the pituitary. So essentially it can lead to all these other factors where they can have increased fat production, they could have alterations in glucose levels, it can affect their mood, and even in children it can affect obviously the growth of the child. And they can also have blood sugar issues as well. Other ones are prolactin. Actually, there's a beneficial response from prolactin. It's once again released from your anterior pituitary, and we'll talk about this in endocrine. But prolactin is what is needed for lactation and breast development, essentially. But prolactin levels do actually increase in the plasma as a result of stressor stimuli. So even like if a patient had surgery or an acute injury, prolactin levels actually increase. Oxytocin is another one. Once again, this actually is linked, or I'm sorry, not linked. It's actually required once again for breastfeeding and lactation as well. Once again, it's through that through the hypothalamus and the pituitary. It's also produced during orgasms during both sexes or for both sexes. So basically, once again, it can promote a reduced state of anxiety, increase bonding, and reduce HPA access. So oxytocin actually has like a beneficial effect there, essentially. Testosterone is another one that can be affected. So long-term stress can actually decrease testosterone levels. And once again, obviously, testosterone is one of the male hormones that we always think about, but it's also in women too. Obviously, the levels of testosterone in women is lower than it would be in a male. But basically, it can, even if it's low in women, they can have higher incidences of autoimmune diseases as well. And it can affect wound healing. It has obviously an effect on your immune system. Obviously, it develops sex characteristics in the patient's libido, male and female as well. But definitely stress can cause a reduced testosterone level in both men and women. The important thing to kind of think about here too is, the stressor for one person may not be a stressor for another. So how we perceive things is different, amongst another person. And really, it depends on those coping mechanisms that they have in place, their personality traits, or even underlying diseases that are already present, essentially. But when we talk about like psychologic distress, obviously, like I mentioned at the beginning, it's, that unpleasant arousal after life events. They could be physiologic, emotional, cognitive, and then also obviously behavior changes as well. So it predisposes them to a lot of different physiologic issues. And once again, too, it contributes to the onset of mental health illness or different mental health disease states, or can contribute to exacerbations of that. So obviously the big thing for our role as a nurse practitioner is making sure that we are addressing this and we're assessing their stress in life, and is it impacting their chronic disease, and how can we help improve this? So counseling is really imperative when we talk about stress, because we can't just put medicines on as a Band-Aid. I mean, really the best thing to do is always to add in different coping mechanisms for the patient, whether it be counseling or exercise, or just different mechanisms to help reduce stress in life. Because obviously, once again, we want to get to that root cause and, help them identify mechanisms to cope with stress, essentially, or reduce stress. So that's the number one important thing, is to recognize it and to actually always assess that in your patient. Are they under an amount of greater stress, or is any life changes that are happening in the patient's life that can contribute to, the exacerbation of the disease? If their hypertension is not well controlled all of a sudden, or their blood sugars are not well controlled, it's really critical to address this and assess that in your patient. And then once again, obviously it's linked to a lot of different disease states, like coronary heart disease. That's one, obviously, too, because it promotes inflammation. And then you think about all those cardiovascular effects from, like your sympathetic response and all that. So obviously, we'll talk about this, too, as we move through different disease states. And I just wanted to bring it in early enough that we can go through it. Oh, real quick, aging and stress, obviously, too, they almost call it like a stress age syndrome. As the patient ages, there's a multitude of factors that can be, affected by stress, essentially. And these are just different changes. I don't expect you to memorize each thing on here, but it's just to give you an overview of it. But they can have changes in their limbic system or their hypothalamus. They can have an increase in catecholamines, antidiuretic hormones, ACTH, and cortisol. So that's why, they're more susceptible potentially to like developing hypertension or a lot of those other, disease states. Decreased testosterone, that's very common in general. And obviously as you age, it becomes even more common. Thyroxine from the thyroid, that's another common factor that you will see, and even other hormones. A lot of times you see a reduction in those hormones. Alterations in opioid peptides, immunodepression or suppression, essentially, alterations in lipoproteins, so you might see their lipids kind of altered as they age. Hypercoagulability, free radical damage of cells. And we'll also talk, too, about a lot of other environmental factors that can impact, the disease process as well. In conjunction with genetic factors as well. So if you have any further questions on this, obviously, please let me know, and I would be happy to help. I hope you have a great day. Thank you.